brought your journal today. Do you mind taking a look at that while I talk to your mom for just a second? Here's a pen you can draw with if you want to. Okay. Mrs. Patel, I'm gonna go over the treatment plan with you, and based on all the assessments that I've done on Maya and filled out this risk assessment worksheet. Since she does have visible cavitations, that automatically puts her at a high risk for cavities. We also found some cavities based on her x-rays. She does have a few white spots on there that aren't completely hard and mineralized. She has a history of restorations. She does have an inadequate saliva flow, so low saliva flow due to her medications that she's taking. So dry mouth, that can also cause cavities because your saliva lubricates your mouth and helps to remineralize the two surfaces that are being decayed. So based on all of that, I put her in a high risk category for that. So that's the main thing that we're going to focus on today. She does also have a moderate risk for perio, and what that is, that's just a destruction of the gum and bone that supports your teeth, and that's irreversible. She does have a little bit of visible plaque on her teeth, so I marked that on there. She also, right now, she has gingivitis, which is an infection of her gums. So when I'm taking those measurements around her gums with my probe, she's bleeding, so that's an indication of the infection. We can fix that and restore her back to health with that. Let's see, and then that also, I marked her for her medications on there because it is causing her dry mouth. And then also she has functional oral habits with her tongue brush. She pushes her tongue against the back of her teeth, so that also puts you at risk for periodontal disease.
Okay.
And then she has a low risk for her oral pathology since she does have oral habits with her tongue thrust. I marked her on that, and then her decreased saliva flow from her medications. So do you have any questions so far on that?
No questions so far.
Okay. So based on all of that, the treatment plan I have created, I'm going to disclose her teeth, which what that is just like food coloring that we paint on her teeth that shows the areas of plaque that where she may be missing when she's brushing. Does she have any red dye allergies?
No, she has no red dye.
Okay, so then that'll be safe to use on her. So once we do that and it shows all of her plaque on there, my plan is to polish all of that off as much as I possibly can, and with what I can't get off with that, I'm going to use my one of my instruments to deplaque with that. And she does have a little bit of tartar on her lower teeth facing her tongue, so I'm going to scale that off with some of my instruments. And then when we're done with that appointment, I'm going to use a fluoride varnish on her since she is at a high cavity risk. We're going to paint that on her teeth, and with that she won't be able to eat or drink anything hot for 4 to 6 hours.
Okay.
So, and then we recommend
She'll do that.
not brushing her teeth that night, and then she can resume regular oral care the next morning.
Okay.
And since she does have a little bit of apprehension and anxiety, we need to take impressions on her to study her occlusions and study models. So I was gonna put that into another appointment. That way we're not overwhelming her all in one appointment.
Okay.
So, and then also with that, I would
Are you
like.
sure you don't want to do it in one appointment? We can just get it all done right now.
We'll see how she does. I might have you leave the room because children sometimes do better when their parents aren't in the room. Maybe we can calm her nerves and help her to do it, but I don't want to give her a bad impression of the dentist. We want her to have a good experience here.
Okay.
But I would also recommend doing sealants on her permanent molars that have already come in, and what that is, that's just gonna, on her chewing surface of her teeth, that's going to get in all those grooves and pits and cover that up and prevent decay from getting into there. So that's a preventive measure that we could do on her.
So that's good.
Yes, yes ma'am, very good. And then, so we'll do that first in our second appointment, and then we will do her lower impression and her upper impression in the second appointment. Do you have any questions on the treatment plan?
I don't.
Okay. If you would agree to that, I'll have you sign it for me, please. Maya, can I see your pen? Thank you. Thank you, ma'am. Maya, I'm going to tell you a little bit about what we're going to do.
Okay.
Is that okay with you?
Yeah.
Okay. So we've already done all the little tests on your teeth to see what we need to do to treat you better. We're going to separate it into 2 appointments. I'm going to paint this stuff on your teeth that's going to turn your teeth funny colors like blue and pink and purple.
Really?
And what that's going to do, yeah, it's pretty neat. And I'll show you a mirror so you can look at it. What that's gonna do, that's gonna show the areas of those sugar bugs that have been sitting on your teeth for a while, where you might be missing when you're brushing or when you're flossing. But I'm gonna remove that. I'm gonna tickle your teeth, and it's just like a little cup that's just gonna spin around and remove those sugar bugs. And whatever I can't get off with that, I have these special instruments that will take them off and make your teeth nice and pretty. Okay, and then I'm gonna paint another thing on your teeth that's gonna make them strong and healthy and prevent any more of those sugar bugs can sometimes cause cavities. Do you know what those are?
No.
Okay, what that is, that's hurting your tooth surface. It's making it softer, and your tooth surface is supposed to be nice and strong. So what the paint is gonna do, it's gonna make it nice and strong in the areas that might be soft, okay? Okay, and then in your next appointment, I'm gonna make you a cool study model of your teeth. That would be cool to have, right? Yeah, so we're gonna do that in your next appointment, okay?
Okay.
All right.
Do I get to keep it?
Yes, you do. You can keep it. Do you have any questions for me?
I don't think so. Is it gonna hurt?
Not at all. We're gonna make this a fun, exciting experience for you, okay?
Okay.
Okay.
Because I'm kind of scared.
You'll be okay. We'll get through this together, okay?
Okay.
All right. And Maya, I'm gonna have you rinse with this dry mouth rinse once at night after you brush your teeth, and that's gonna help to help with some of the symptoms that you're having from your dry mouth. And so if you just want to have her rinse with this once at night, that'll also help reduce her cavity risk. It's
Okay.
gonna moisturize her oral environment.
And this is for dry mouth?
Yes, ma'am. Specifically for dry mouth.
Okay. That's what we're gonna do, Maya.